With that, I would yield 3 minutes to the gentleman from Montana, a terrific new member of Congress in the Energy and Commerce Committee, Mr. Gianforte.
The gentleman from Montana is recognized.
Thank the gentleman for the time. Madam Speaker, I hear from hardworking Montanans in my office and throughout the state that they're worried about the rising cost of health care. Rising premiums, increasing deductibles force Montana families to spend more and more on health care and less on clothes and books and food for the table. Since my first day in office, I've made lowering health care costs, promoting rural access to care, and protecting those with pre-existing conditions my primary priorities. Unfortunately, the Affordable Care Act has been anything but affordable. In the first 3 years of Obamacare, premiums in Montana rose by 66%, and they're still rising today. Obamacare robbed consumers of choice and gave hardworking Montanans plans they can't afford. As we work towards solutions that make health care more accessible and affordable, I'll keep fighting to protect those with pre-existing conditions. I co-sponsored the Preexisting Conditions Protection Act that ensures patients with pre-existing conditions have access to health insurance. I also voted to ensure those same protections. We need to ensure that those with pre-existing conditions have coverage. House Democrats have said they're for protecting those pre-existing conditions. Unfortunately, Madam Speaker, it seems they're only interested in defending them if the solution includes preserving Obamacare or pursuing a government-run single-payer health care plan. One of the earliest votes we took in this Congress was to lock in protections for Americans with pre-existing conditions. It was a simple and straightforward measure that I enthusiastically voted for. It would protect Americans with pre-existing conditions, period. So simple and straightforward. We should revisit that approach. Unfortunately, Madam Speaker, my friends across the aisle voted down that measure because it appears the majority values trying to score political points more than providing certainty and peace of mind to Americans with pre-existing conditions. I hope they'll come to the table in good faith and choose to work with us to find a bipartisan solution to bring down health care costs and protect people with pre-existing conditions. And with that, Madam Speaker, I yield back.